Hello and welcome to today's pre-op class. I am going to get my screen share all set up here. I am Amber Brown. I'm one of the athletic trainers here at Holy Cross. So we'll go ahead and get started. I just want to first of all say welcome and thank you for choosing Holy Cross for your knee replacement. We have some amazing doctors here and they have great staff, so you guys are in really good hands. I also want to thank you for just the flexibility in watching this recording. I know that this is a little bit different, but it's made things a lot easier so you don't have to make a trip all the way down here just for a pre-op class, okay? So today we're going to cover a lot of information. I'm really just going over expectations before, during, and after the surgery. And then any questions or answers, I'm going to direct you to your specific surgeon's team. You can ask them anything specific that maybe wasn't covered today or refer to the folder of information that you got when you booked the surgery. So you guys are all watching this because you are having a knee replacement surgery. I will show you, I'm a visual person, so I just like to see kind of what a normal knee looks like versus an arthritic knee. And the definition of arthritis is you have lost that joint space or that cushion between those bones. So they start to touch bone on bone, and that is arthritis. The cool thing about a knee replacement is it takes away the arthritis. And again, I'm visual, so I like to show you the model in case you didn't see it when you were here to discuss with your doctor. On the screen are the x-rays, so that's what your knee's going to look like after you have a knee replacement put in. And I like you to understand that they're not just going to kind of take out your whole knee and put this whole new thing in. It's really more of a resurfacing. So they're going to shave away the parts that are arthritic on your femur and also your tibia, and they're going to put these end pieces on there that are made out of like titanium and cobalt chromium. And in the middle, they put this little plastic piece, which is made out of polyethylene plastic. And then same thing, your kneecap is your kneecap or patella, but they shave away the backside so that it's nice and smooth, and they put this little plastic button on there so that when it's all put together, everything glides nice and smooth, and you will be able to straighten and bend your knee the way you're supposed to, okay? If you are having a partial knee replacement, this is just what the x-rays will look like. It's a little bit of a smaller procedure. They're only replacing one part of your knee instead of those three parts, okay? One thing that is just a little bit different at this time is that most of these surgeries are being done as more of an outpatient basis, and that means that our goal is to get you home the same day as your surgery. If you have a medical history or your doctor discussed with you staying overnight to monitor you, then they'll keep you overnight and then get you home hopefully that next morning. But certainly, more often than not, for the last year or so, most everyone's been going home the same day, if not the next morning, and it's been working out really, really well, okay? There are some exercises on here just for before and after surgery. You should have a handout of exercises in your packet as well. Really, we just want you to stay active, whatever way that is, whether it's walking or swimming or riding a bike or going to the gym. Keep doing what you can do to keep those muscles nice and strong. So after the surgery, they're not so sleepy and take a while to wake up. They already kind of remember, so they'll go right back into doing some of the things that you had done before. A person or a group of people that we do like to just recognize is whoever your companion or your support system, your tribe, whatever you want to call them. The reason why most people do so well is because you have great support systems, whether it's neighbors or friends or family. If you have somebody that can just at least call and check on you, you're going to be functional. You get up and you walk the same day as your surgery. So we don't worry about that. You guys are gonna do fine. You're gonna get up, you're gonna make your own coffee, make your own sandwich. But you do need to have kind of that support system, the people that are gonna help get you to and from the hospital, encourage you, support you. The one thing with COVID is, unfortunately, at this time, no one's allowed to come into the hospital with you for the surgery per se. If those protocols change, the hospital staff can update you on when they're starting to allow people back into the hospital. But right now, with the COVID restrictions, we are still restricted in some ways. Okay. I do want you just to think about preparing your house. You don't need to go do all sorts of things, but do a walkthrough. Make sure any clutter is picked up. The little throw rugs in your bathroom, just kind of roll those up and put them in a linen closet for now, so that you don't have a trip hazard. We just don't want you to be walking with a walker and those wheels get caught up in something and you go one way or the other. Also, just plan for some easy meals. Like I said earlier, you're going to get up and make your own coffee or sandwich, but for convenience, have some things in your freezer or your fridge or just a plan in place for how you're going to get some easier meals for those first week or two after surgery that you're not going to feel quite like standing for too long. Also, think about your pets. You're going to need some help with walking them, big or little dog. We don't want them to pull you or get up under the walker and have you trip or anything like that. So just have a plan in place for how your pets are going to be taken care of. Don't forget about them in your planning process. And then you do need to just make sure you're aware with like the comfortable clothes that you pick to wear to and from the hospital. Ladies, leggings are super comfortable. I know, trust me, but you're not going to need to wear leggings after the surgery. You're going to go home with maybe some ACE bandages on your legs or something. So they're going to need easy access of the lower leg and some of the thigh potentially. So I wouldn't recommend leggings, but some loose, comfy gym shorts or pajama bottoms or a comfy like summer dress or muumuu dress. All those things are great for going into and leaving the hospital. And then also just think about your shoes. We live in Florida, so kind of out of habit, we put on our slides or our flip-flops or sandals. But after a knee replacement, you're going to want some shoes with a backing so that you don't get tripped up and have a fall. We kind of touched on it, but with transportation, you do need to just make arrangements for who's going to help get you to and from some appointments and probably physical therapy for the first couple of weeks. And then on those same lines, you can't be driving while you're taking the pain medication. So just things to consider. As far as the shower or the bath access, go by whatever instructions your doctor gives you. They will give you specific instructions. For some of them, you may not be able to shower for the first 2 weeks. You're going to be doing like a sponge bath alternative. You just don't want to get that incision wet and leave it wet and harbor any sort of bacteria or possibility for infection. Okay. So coming into the hospital, you do need to get a walker beforehand. Please do not wait until you get to the hospital and think, oh, they're just going to give me a walker there. It is best to get the walker beforehand and have it in the vehicle of whoever is going to be picking you up. Okay. Sometimes you can get this through your insurance if it's like once every 5 years. But if your deductible or copay is going to be more than 30 bucks, just go on Amazon and get a standard rolling walker on Amazon. They're about $30 or $32 on there, and you get it in about 2 days with Prime shipping. So it's a win. Just be mindful of the walker. They do have heights on there. So if you're really short, there's a junior walker. If you're really tall, there's a tall walker. So just make sure that you fit within whatever parameters there are for the walker when you're ordering it. The one in the middle is marked out just because you don't need a fancy 3 or 4 wheel walker. They're not the safest after surgery. If you got a little miscombobulated, that walker is going to go one way and you're going to fall back and hit your head or open up your incision. All those are things that we do not want to happen. For the 3-in-1 commode, that's also crossed out because you do not need that after a hip replacement or a knee replacement, I'm sorry. We want you to sit on the toilet and bend the knee and get up. So that's actually cheating the system. So you do not need a 3-in-1 commode. Okay. We do want you just to think about your health and optimizing your health. We don't want you to go on any crash or fat diets, but do certainly eat some good protein, especially after the surgery. It's going to be important for you as you're recovering and healing. And then also just think about getting some rest now. The most common complaint at the 2 week post-op visit is that you are not sleeping well, and it's from the stress of a major surgery. And we understand that. So just try to get some rest before you go in for the surgery because we know afterwards it's not as easy to get the rest that you want. As far as smoking, smoking has some increased risk of bad things happening like DVTs or blood clots and stroke. It can delay your healing for the wound. A lot of our doctors here will not operate if you're smoking, so that's a discussion that the two of you should definitely have, just so that we're keeping you safe, okay? Also, before the surgery, we do want you just to get this Hibiclin soap. You can get it wherever you do your shopping, whether it's Publix or Walgreens, Target, CVS, just go in the first aid section and you'll find this Hibiclens. It's our infection control protocol. So you're gonna use it per your doctor's instructions. Some will have you do it the night before and the morning of surgery. Some of them will have you starting it 5 days prior to surgery. So those instructions are in your packet of information you got. Go by whatever that says. It also has instructions for how they want you to use it. Just be mindful of not shaving your legs within a couple days of the surgery, just so you don't get any nicks or cuts and things that could be a possible site for infection. And then also along those same lines, if you're somebody that's on the boat a lot or does a lot of gardening, just be mindful to keep your legs nice and clean and free of those cuts and scratches and things as well. Okay. I do like to remind our patients, just put some clean bed linens on, use a fresh towel and washcloth and things so that everything is just nice and clean and ready for you, especially for when you come home from the surgery too. One thing that at this time, the hospital is still requiring a COVID test prior to the surgery. They will call you and they'll schedule it usually a couple days before the surgery. Even if you've had your vaccine, this is something that they're going to request that you have done. They will let you know if this protocol changes over the next couple of months, but as of right now, they are still requiring the COVID test for your surgery. Okay. So items for the hospital, just make sure you bring your current list of medications with their dosages. You don't have to bring all your medications in with you to the hospital itself, unless it's something that's super brand specific for like HIV or post-transplant or diabetic medication. You could bring those in the pharmacy bottle, but otherwise just bring your list. The hospital will give you what you need as you need it while you're there. And most of your medications you probably won't even need while you're in the hospital. Don't forget about your loose, comfortable fitting clothes. You can honestly wear what you wore into the hospital going home, especially if you're going home the same day. And then you're going to want to bring in your ID card, your insurance card, and a credit card. They do have once a day, I believe, a delivery with Walgreens where they will try to deliver like your post surgery medications to you, like the pain medication, but you do need your credit card to arrange any payment. If you aren't able to do the bedside delivery, then they will send the prescription to your pharmacy via fax or give you a hand script. So one way or the other, you will be taken care of, but I just like you to be prepared. Leave your valuables at home, like your jewelry, your wedding ring, your earrings. Leave all that stuff at home. There's no place for that in the hospital. If you want to bring your cell phone, you're more than welcome to do that and let your loved ones know how you're doing once you're awake and in recovery and things. That's fine. Minimal items really is best. So you don't need a big rolling suitcase or anything like that coming into the hospital. You can have a small bag that's ready, and if your family needs to arrange getting that into you, if you ended up staying overnight or something, then just kind of have that on the back burner. You do still need to wear your mask coming into the hospital. We are a hospital facility and they do require you to wear the mask while you are there. So just something to be mindful of and think of as you're coming in for the surgery as well. So the day of surgery, I hope everyone knows your surgery is not here at the Ortho Institute. It's at Holy Cross Hospital, which is off of Federal and Commercial Boulevard. You'll go through the main entrance on the day of surgery. You probably do not know your arrival time yet, and that's okay. Your doctor's office is going to call you about 24 to 48 hours before and give you an arrival time. Okay? We just wait until we have everyone's clearances in order to give out those times so that we don't confuse anyone. When you get there, you'll go to the reception desk, let them know you're there for a surgery, and then they're going to send you to the admissions. You'll finish up any paperwork and things there, and then they're going to send you up to the pre-op area. In pre-op, we do have you arrive usually about 2 hours before your surgery time, and that's normal. There's a lot of stuff to be done. Don't be surprised if the hospital staff ask you your name and your date of birth 500 times. It's just because they have to make sure you are who you are and confirm that all along the way. So they're going to get everything ready. You'll get a super cute hospital gown. You'll also get some little anti-skid socks, so don't go buy anything fancy. They will establish your IV where you're going to get antibiotics before and after the surgery, which is just another precaution that we take to avoid infections. The anesthesiologist is actually going to come in and meet with you and go through your options, what your doctor's preference is, what your medical history allows for, all those things. You can ask them questions about the anesthesia, and then your surgeon's going to come in and you'll mark which knee you're having an operation on together, and he'll go through any questions that you might have at that point too. Just remember, you are your own advocate, okay? Just as the hospital has to ask you your name and your date of birth 500 times, don't be afraid to say, hey, these are my allergies to every person along the way as well. Always be your own advocate, and that's not just here at Holy Cross, that's anytime you go to a doctor's office or go for a procedure or whatever it might be, okay? Also, on that note, the anesthesiologist is your friend because they give you a nerve block um, around the time of the surgery. And that's really what helps to reduce the pain around the knee. It's a little gift to you. So we'll talk a little more about that later, but the anesthesiologist is your best friend. So remember that, okay? So when you wake up, you're going to be in the recovery room. They're going to be making sure that your vitals and everything are stable, that your pain is under control. You will have an ice machine that goes home with you. That is your best friend. Say hello to it. The one you wake up with goes home with you, okay? Physical therapy, they're going to come to that area and they're going to do physical therapy with you in the hospital. They're going to get you up, they're going to walk you. You'll be able to go to the restroom, all those things at that point. If you have stairs at home, you tell the physical therapist, I have 5 stairs to get to this place in my house, so that they can teach you how to do that, because you will be able to do it after the surgery. As far as the procedure goes, the procedure itself only takes about an hour. Like I said, family cannot come into this part or in the recovery area at this time. But one of the most important things is that we get you up and we move you. It's going to help avoid any delays in healing, like blood clots and things. So moving and walking are the most important things after a knee replacement that we want you to do. Once you have been able to urinate successfully and you're deemed medically safe, that's when they'll let your loved ones know that you're ready to go home. And like I said, there's quite a few people that help make that decision to make sure you're medically safe. So if you are not safe and they don't feel comfortable, then they'll keep you overnight and they'll monitor you, give you that extra therapy session, whatever it might be. Okay. So our goal is to get you home, and that's, our goal from start. It's the most safe place for you to go. It's the place with the least amount of risk, honestly. You have less chance of an infection in your own home rather than if you went to like a skilled nursing facility or a inpatient nursing facility. Those places carry a lot of germs and things. So we want you to go home. Your best chance of getting better quicker is at home. You're forced to be kind of independent and get up and move about and do your normal things and get in your habits. So we like that. Okay. As you're transitioning home, they're going to have your prescriptions and medications. They'll let you know what you can take once you get home. You'll have whatever they're prescribing for you, they'll let you know. There are case managers that are working behind the scenes. You might not actually see them at the hospital, but there are case managers that work specifically for the orthopedic floor. You're going to also have instructions on how to care for yourself. You may have gotten some of that information in the packet for the surgical booking. And then you'll have instructions on when your follow-up is. Sometimes the doctor's office make those post-op appointments before your surgery, or some of them may call you a few days after. Each of them have their own protocol, but you will get information on when your follow-up appointments are scheduled. Some doctors may see you at 2 weeks or 4 weeks and then 6 weeks. It just depends on each office. So you'll get that information from them specifically. Just do me a favor, and if you have questions or concerns or whatever it might be, make sure you ask your questions. Don't just go home and be confused until you see the doctor. Always just make sure you reach out so that we can answer your questions or answer your concerns. As far as recovery goes, sometimes you might be provided with home health services. Not everyone is a candidate. It really depends on your medical history, your doctor's preference. So if you were getting home health, there could be a therapist and a nurse that come to your house for the first week or two. And those usually start within about 24 hours of you going home from the hospital, depending on your insurance. Everyone with a knee replacement is going to go to outpatient therapy, whether it's directly from surgery or a couple weeks later. Your doctor would let you know if they when they want you to start this or the timing. But the outpatient therapy is really, really important after a knee replacement. Okay. So you are responsible for arranging those appointments at whatever facility you're comfortable with or is close to your house. And you usually go to that for 2 to 3 times a week for the first month or 2 months or so after surgery. Could be a little bit longer. Just one of the most important things is remembering that these exercises are not just for right after the surgery, they are a commitment for yourself so that you continue to get better and that knee replacement works the way it's supposed to. You keep doing your exercises so that you keep everything around it nice and strong and working properly. So how should you expect to feel? You're going to have some swelling around the knee joint. That is common. It's also not uncommon for some of that to go into the lower leg or the foot and ankle. So we ask that you elevate, elevate, elevate. Get your legs up above heart level for at least 15 minutes a couple times a day. And your therapist should be reiterating this as well. Warmth around the surgery site, that's normal. You have swelling and you have metal that wasn't in there before. So swelling and metal together are going to create this heat or this warmth that wasn't around the knee before. Dark red and purple discoloration is not uncommon, or bruising, especially around the thigh. They use a tourniquet for the surgery so that you're not bleeding into the joint. So some people will notice more of that bruising and discomfort in the thigh than around the knee itself. That will get better, I promise. But for the first couple of weeks, some of you may notice that. The skin blisters are real, especially if you have an allergy to an adhesive. So make sure you let anybody along the way that would be changing the bandage know if you have an allergy to adhesive. And if you get a skin blister, do me a favor and don't pop them. Just keep your fingers away from it so that you don't harbor any germs or bacteria. Numbness around the incision, that's pretty normal. They have to cut nerve endings anytime they open up the skin for a surgery. Most of those will regenerate. You might even feel little zings within a couple weeks of your surgery. That's actually a good sign. It means that there's healing. But most people notice that numbness and they do mention it. The painless clicking in the joint is also normal. I can actually recreate it on the model because things aren't quite strong and because there's swelling. So this is a mechanical part now. So sometimes you might hear or feel a clicking until things get stronger and the swelling goes down. I do like to mention this is the discomfort in the back or other joints because you've been walking off kilter, not for weeks, but for probably years, even if you didn't realize it because of your knee. So now that you have a new, nice straight leg with this new joint that's working properly, some of the joints above and below the surgery will give you a little bit of an issue or could be a little uncomfortable, or your sciatica could flare up. I just don't want you to be caught off guard if that happens. So just be prepared, do whatever tricks you have in your back pocket for when those things happen. And the more you walk, the more it's going to train your brain and the rest of your body to kind of fall in line and get in sync. Okay. So pain management, even with the best pain management, you might not be pain-free. It's a risk of any surgery, but you are the expert. Take the pain medication as it's prescribed, especially for those first couple of days. I told you the anesthesiologist gives you a nerve block, but that wears off at about day 2 from surgery or a little before. So don't be a hero and say, I'm not going to take anything because you're going to know when that nerve block wears off. You're going to feel it. I would rather you be prepared and not have pain than try to react to pain because that's much, much harder. Okay. If you are somebody that's under a pain management contract, that does need to be discussed with your pain management doctor and let your surgeon know prior because that will change your post-op pain management. So surgical site infection, this is very rare at Holy Cross. But this says fewer than 3 out of 100, but at Holy Cross it's less than 0.5%, which is well below the national average. This is why we have you use the Hibiclens and we give you antibiotics through the IV and we get you home where it's your germs. It's just to keep you safe and to keep infection away from you, okay? I show you this picture not because I want to scare you, but because I want you to know what looks concerning. If you are concerned of an infection in the knee, you might have a fever over 101 degrees, not 100.1, but 101. It could be painful, bright red discoloration like you see, and it spreads along the incision and away from it. Any like discharge or pus from the incision, those are all reasons to call your doctor's office. Don't be surprised if they say, hey, can you email me a picture? Because we know we see this. Yes, we're concerned, or no, that looks pretty normal. Okay. Just remember some redness and warmth and that bruising or discoloration, those can be normal. But this knee, you look at this picture and you know this does not look normal. Okay. Other causes for concern: increased calf pain and swelling. That can be a sign of a blood clot. We want to know about it and get you an ultrasound if we're concerned, and get you the appropriate medication if you had a blood clot. Pain medication that you go home with is typically a narcotic, and that can have side effects on its own, like nausea and constipation, drowsiness and confusion. If you know you have issues with constipation, just make sure you have stuff on hand at home, like Colace or milk of magnesia, magnesium citrate. Drink your water. Drink half of your body weight in ounces of water every day to keep things moving along. Eat leafy green vegetables. All of those are good tips and tricks. Along those same lines, though, the narcotic also usually has Tylenol or acetaminophen in it already. So once you go home, be careful of medications that you take on top of your pain medication. If you're taking the pain medication regularly, you should not be taking any extra Tylenol because then you're going to go over the amount that you can have in a day, and that can be toxic to your organs. If you go home on an injectable blood thinner, you shouldn't be taking over-the-counter anti-inflammatories like Aleve, Advil, ibuprofen, Motrin. Those can be considered a blood thinner as well, so that's not a good recipe. And then just also be careful with sleep aids at night. Most of you are going to take a pain medication at night to help you sleep, but then if you take a sleep aid on top, and both of them could cause you to be drowsy and confused, I don't want you to get up and have a fall in the middle of the night. So just be mindful of all those things and how they might interact with one another. Depression and anxiety. That is not uncommon to go into what we call kind of a post-op funk. When you have pain and your independence is taken away, and then you have these medications that have side effects, they can cause you to feel a little like anxious and depressed. So everyone recovers a little bit different. Please don't compare yourself to other people with knee replacements. It's like a tomato and a tomato. Everybody is a little bit different, or recovers a little different, or bounces back a little faster or a little slower. Your recovery is your recovery. Just make sure that you have a good support system set up of family and friends. And if your mental health is something that you're concerned about, talk to your primary care doctor. You don't want your orthopedic surgeon managing your mental health. Okay. So, activities: walk, walk, walk every day. Just promise you're going to walk. Promise you're going to work on straightening and bending the knee. Once you have enough range of motion, you'll be able to get on a stationary bike, and that's a great exercise for you. Like I said earlier, you can do stairs after the surgery. You're just not going to want to go up them 500 times, but you will be able to go up and down them. So ask the therapist to teach you so that you feel comfortable and confident doing that. Do not drive until you have permission, please. I don't want anyone driving in their car near my neighborhood with my two little girls, and you don't have the reaction time or the reflexes to stop if you didn't see them from a mile away or whatever it might be. So just keep yourself safe and keep others safe by not driving until you're allowed to. As for sexual activity, that's safe whenever you feel comfortable. There's no real restriction from a knee replacement for that. So recovery is hard work, but you guys are not alone. You have great surgeons, you have great teams, the therapist, the nursing staff, everybody is on your side, okay? Your family and friends. Everyone is on the same team and everyone's goal is to get you better, okay? So make sure you reach out if you have questions or you have concerns, whatever it might be. Make sure you reach out to your doctor's team, okay? Thank you very much. I'm going to go ahead and stop my share.